Hi, my name is Grace Ellison, and this is my finished product of my anatomical head structure assignment. I'm going to first start off by explaining the cranial bones. This first cranial bone is the frontal bone. The frontal bone is an unpaired bone, and it makes up the forehead and the roof of the eye sockets. This is the coronal suture, and it separates the parietal bones from the frontal bones. These two are the parietal bones. The parietal bones are paired bones, and they form the lateral and superior portion of the skull. And this right here, I forgot to mention, is the sagittal suture. It separates the two parietal bones. This is the temporal bone. It forms the side of the skull and surrounds the ear region. It also houses the structures for hearing and balance. And this is the squamous suture, and it separates the parietal bone from the temporal bone. The temporal bone is also a paired bone, and it has another one on the opposite side. This is the occipital bone. The occipital bone forms the back and the base of the skull, and it is an unpaired bone. This is the lambodial suture. It separates the occipital bone from the parietal bones. This is the foramen magnum, and it is the junction for the spinal cord, and it is located on the occipital bone. This is the sphenoid bone. It is a deep cranial bone. It forms the base of the skull, and it also forms part of the eye socket. And this is the zygomatic bone. The zygomatic bone forms part of the cheek, and it forms most of the side of the eye socket. This is the nasal bone. The nasal bone forms the bridge of the nose. This is the maxilla. The maxilla forms the upper part of the jaw and supports the upper teeth. This is the mandible. The mandible forms the lower jaw and supports the lower jaw. This is the hyoid bone. And now onto our muscles. This dark green muscle right there is the levator labii superioris alaci nasi muscle. This muscle helps to elevate the lips, and it also elevates the wings of the nose, especially whenever you're scrunching your nose and your nose dilates. That is what this muscle is doing. It's helping to raise those wings of the side of your nose. This orange one right here is the levator labii superior muscle, and this muscle elevates the lips. This yellow is the levator anguli oris muscle, and this one aids in smiling and elevates the lips during smiling. This greenish blue is the zygomatic minor muscle. The zygomatic minor muscle aids in smiling as well and elevates the lips. And this reddish purple is the zygomatic major muscle. The major muscle helps to pull the sides of your lips whenever you're smiling, and it also aids in just elevating the lips. This is the dark blue right here. This is the rosaurus muscle. The rosaurus muscle is used to move your lips laterally. Like, for example, whenever you're saying the vowel E, it moves your lips laterally and pulls them back. This light blue is the buccinator muscle. The buccinator muscle's job is mainly to keep food in between your molars, and for infants, it is used primarily for that sucking motion. This light green is the masseter muscle. The masseter muscle is one of the main chewing muscles, and it also moves the mandible and the jaw with force in order to chew our food. This purple is the temporalis muscle. The temporalis muscle is also one of the major muscles used for chewing to move the mandible as well. And then for our next muscle, the orbicularis oris muscle, this is the lip muscle. This is used for movements like kissing, pouting your lips. Whenever we are speaking, it is using those lip movements and muscles to make all of those shapes and sounds. Now for our depressors down here, this red one, this is the depressor labii inferioris muscle, and this is used to depress and pull the lips down. This blue is the depressor anguli oris muscle, and it is also used to pull your lips, especially whenever you're pouting. And this is the mentalis muscle. This one is used also for frowning and pouting, and it, like whenever you're doing this, for example, it wrinkles the skin of your chin right there. That's the mentalis muscle. Right here underneath the mandible, this one right here is the geniohyoid, and this one's only on this side because it's superficial to the mylohyoid, and this helps to elevate and draw the hyoid bone forward. This is the mylohyoid, and this one is on this side because it is more superficial, so that's why we can see this one on this side. And this helps to elevate the hyoid, the floor of the mouth, and the tongue. This is the anterior digastric, and this is used to pull the hyoid bone. Right here, pull the hyoid bone up and forward. And this is the finished product. Thank you.